comprehensive eye examination involves an undilated and a dilated eye examination. First, we check the visual acuity, and then we check the intraocular pressures. We use a slit lamp to look for any problems in the front of the eye, namely the eyelids, the cornea, the sclera. And we also look at the lens to see if there's any changes prior to dilation. Then we dilate the eyes and look at the back of the eye. Now, the back of the eye is called the retina, and through that we look through the vitreous. And what we're looking for is any problems in the optic nerve, the retinal vessels, and the retinal periphery. For diabetic patients, we want to pay particular attention for any complications that may result from diabetes. We call this diabetic retinopathy. Diabetic retinopathy may present itself as small little outpouchings of the blood vessels. Those are called microaneurysms. We also look for retinal hemorrhages. We look at the caliber of the retinal vessels, both the arteries and the veins. We also pay particular attention to the center of the retina to look for macular edema, which may be a cause of vision loss. Furthermore, we want to look for evidence of ischemia. Now, evidence of ischemia may present as what are called cotton wool spots. Those are little microinfarcts in the retina. We'll also look for abnormal new blood vessels called neovascularization. Neovascularization may present itself at the optic nerve. It may present itself in the retina. It could also be seen as a vitreous hemorrhage. In the front of the eye, we want to look for new blood vessels that may be growing on the iris. We call this rubeosis. And if we see rubeosis, we want to pay particular attention to the angle structures of the eye. So we may do gonioscopy, which is to look in the angle to look for these blood vessels, which may be blocking the plumbing system of the eye. Lastly, we want to make sure the patient doesn't have any scar tissue formation, which may be an advanced form of diabetic retinopathy, which can lead to retinal detachments. As part of the comprehensive eye examination, dilating the pupil of a patient with diabetes is extraordinarily important. The reason why is because sometimes patients with diabetes may present with retinal hemorrhages that are not seen in an undilated examination. And to get a full and complete view of the peripheral retina, dilation is required. There are some patients who only present with what are called predominantly peripheral lesions in diabetes, and so it'd be important to not miss those. Measuring intraocular pressure is part of the general eye examination for any patient. We want to make sure to screen for glaucoma. However, in diabetics, it's especially important because elevated intraocular pressure could mean that a patient has developed neovascular glaucoma. Neovascular glaucoma occurs when blood vessels grow in the angle, which is called the trabecular meshwork. It can block the plumbing system and cause the pressure to become elevated. And if that happens, it's a vision-threatening disease and needs to be treated promptly. There are two other diagnostic tests that I find very helpful in evaluating and managing diabetes and diabetic retinopathy. The first of which is called the Fluoresceinangiogram. Now, what a Fluoresceinangiogram is we inject a dye called fluorescein into a vein, and we follow that dye as it goes into the retina. We have a special camera which takes pictures of the back of the eye. What it does is it allows me to assess for blood circulation, because diabetes affects the blood circulation in the retina. We look for areas of ischemia, or what's called capillary non-perfusion. We look at blood flow, but it also can help determine how much diabetes a patient has. It's very good at particularly looking for microaneurysms and neovascularization, as well as things like intraretinal microvascular abnormalities. I find it particularly useful to follow patients with diabetes to see if they're responding to care. Lastly, it also looks for diabetic macular edema. We often see leakage in the center of the retina, which may need to be treated. I also like to rely on another test called OCT, which stands for Optical Coherence Tomography. And what that is, it's a scan that creates thin sections of the center of the retina directed right at the macula. OCT is valuable for looking for subtle fluid that may be threatening the vision. We also use the OCT test to follow patients who are being treated to see if they're responding to the treatments.